Hello and welcome to Good Life, the health show with me, Puja. Well, this is a show that focuses on providing you with solutions to your health-related issues, lifestyle and much more. Well, viewers, increasing number of cancer cases in the Northeast is a matter of concern. Experts believe there is a need for awareness among the people. The lifestyle-related cancers top the chart in the Northeast region. Now, who are the ones who are playing important role in detecting cancer? It's the radiologist. So to discuss on the role of radiology in cancer, we have with us today Dr. Rahul Runav Ramchari, Senior Consultant Radiologist from Health City Hospital. So not to waste any more time, I'll straight away move to him and talk more on the topic which we have taken today. Although thank you so much, Doctor, for joining to Good Life, the health show. So today the topic which we have taken, we will be elaborately discussing on it. But my first question to you would be like, what is the burden of cancer seen in Northeast India?
Actually, if you see that cancer has become the leading cause of death globally. And in the developing countries like India, if we see that the number of cancer patients has risen every 2 to 3 falls per decade. And the sad part is that in Northeast India, the prevalence of cancer is 2 times higher than the rest of India. So that is a part that is alerting us that why in Northeast India the cancer is increasing day by day and why the rate is 2 to 3 times higher than the rest of the India. So if I go for a data which is published I think 1 year back in the Indian Journal of Research magazine, so they said that if you go for a 10 years databases thing, then you will see that the Aizawl district of the Aizawl district, there has the highest prevalence of cancers for last 10 years in case of men cancers. And in case of female parts, the Arunachal Pradesh, there has the highest number of cancer females.
So if we talk about female section, so Arunachal is the most...
where the patients are coming from.
Most cases are seen in Arunachal Pradesh.
And if you go for Assam, and if you see district-wise divisions, and if you say in the which district you are getting the highest cancer patients, then I will have to say the Kamrup Urban, the Kamrup Metro, they have the highest number of cancer patients. So this is a database study which was published 2021, and they said that in Northeast India, the number of cancer patients are very high compared to rest of India. And as I told you, that the that Aizawl district and the Arunachal Pradesh, they have the highest number of cancers.
Okay. Just to tell our viewers that our numbers are flashed on your television screen. So if you have any question regarding the topic which we are discussing at this point in time, please call up and ask your question. All right, Doctor, coming back to you again now. We were discussing about the data of the cancer cases in Northeast India. Now, what are the main causes of this?
In particular, if I look for cancer, there are lots of causes. But since we are talking about the Northeast today, and particularly in our region, this region, why the cancer is so much highly prevalent? So what are the causes? So first, I have to say that the food habits that we used to have, then the smoking, of course, then the alcohol, then you have to say that the socio-economic status of the people.
Basically the lifestyles,
the sedentary lifestyles, and then the pollution. Now the pollution plays also a big role. It's not the only air pollution, it's the water pollution, that the organic materials that are used in the different vegetables. So this all leads to different kinds of cancers. And also the genetic role sometimes play. But the number that is increasing is basically due to this pollution and the habits that we are having, the sedentary lifestyle and the excessive use of tobacco, betel nuts, then alcohol. All this leads to the increasing number of cancer in our this region.
Now, are we talking about all kinds of cancer, Doctor?
Look, today, I think we are talking about all kinds of cancer in that sense. Today, we want to give some information, how different kinds of cancers can be diagnosed, how they can be prevented, and how they can be treated. So in a broad spectrum, I can say today we are giving a short view of all cancer patients. Any cancer patient or how we progress and how we proceed to the cancer patient. So that is today we'll discuss regarding that thing only.
Now, which is more prevalently seen in Northeast India? Which is the cancer which is most
That's a very good question. If you say, then I have to say in Northeast India, the most common cancer in male patients, again, we have to divide it according to gender-wise. So male patients, you have to say that it is the esophageal cancer. Esophageal cancer is the number one, if I have to say. It will be followed by the lung cancer. then head and neck cancer in case of male patients. And if you say the female patients, it is the breast cancer.
Breast cancer.
It is the breast cancer. For last 30 years, I have to say, it is the breast cancer. This is the most common cancer in female patients. Then you can follow up with the cancer of the gynecological cancers like cervical cancer, then obviously this esophageal cancer. But in case of male, it is the esophageal cancer and the lung cancer. In case of female, it is the breast cancer, which are more commonly encountered in our practice.
Okay. Now, doctor, as a senior radiologist, you are playing an important part in detecting cancer. Now, what are the roles of radiologists? What do you have to say on this?
Look, the thing is that...
Of course, it's a vast role, but still.
Yes.
Yeah.
So, in a nutshell, if I have to say to you, we are those players who have been given the responsibility by the medical science to detect the cases and to prevent the cases and to follow up the cases. So what we usually do, any patient coming to us, if suspected of cancer, we have to first diagnose the case.
Right.
Then we have to send the case to an oncosurgeon or an oncologist to treat the case. And after treat the case, again they come back to us for the follow-up of the case.
Okay.
And now, as the medical science has gone to a very newer level, with newer technologies are developing day by day, and with new procedures, so the new role is the prevention of cancer.
Prevention of cancer.
Alertness of cancer.
Okay.
So the prevention of cancer, again the radiology role has come, which we call in a medical term, it's called screening. Means after a certain age group, we used to screen for some particular cancers.
Okay.
That's
So
why
can we say that doctors are fully dependent on radiologists because they will prescribe for test, they will ask the patient to go for a test, but it's the radiologist, senior radiologist like you, who will be playing an important part in detecting and who will be playing an important part in telling the patient that how the test is going to be conducted.
If I have to say, it's basically a teamwork.
It's basically a teamwork
because the radiologists, there are very famous radiologists in my place, all over in India also, which are known to be an oncoradiologist. So what we guys used to do, we used to play as a team, like in my hospital, 𝗟𝗓𝗙𝗪, so from where I have representing today. So what we used to do, we have oncosurgeon, we have oncologist, we have gynec surgeon, then we have a nuclear medicine, then we have radiotherapist, then we have radiation oncologist. So all of us play as a team, and it's called
teamwork.
It's a teamwork. So our part is to detect the case, and we have to give the guidance. So basically, we play the guidance role. So we, when the clinician send to us the case, so we have to guide them whether it is cancer or not, and sometimes it is called suspicion. It might be suspected of cancer. Then again, we have to sit in a team. It's called tumor board meeting. Then in the tumor board meeting, we have to manage the protocols. Then we guide the patient. So basically, it's a teamwork where every member has the equal roles, if I have to say.
Also a very important role because you guys are playing, it's a teamwork actually, and you also have, of course, back-to-back meetings regarding the case study, which you all do, depending on the patients as well. And also, of course, do you consult the doctors as well if the patient is critical or something like that?
Exactly.
What is the role on that part?
Because we have to look, if suppose a patient is coming with a lung cancer or a stomach cancer, so like my oncosurgeons who are there, they are my colleagues, so they used to come to my place, then come to my workstation, then we discuss the case, we guide them, that you can go to this way, then the tumor can be easily removed, then they will discuss with us. Sometimes they called us to the operation theatre with the ultrasound machine. We guide them intraoperatively. After the treatment, they again send the patient to us to see whether tumor has been completely removed or not. So it's like we have to guide, they ask our help, and we also give them our inputs regarding the patient.
All right. Now, doctor, what are the modalities of radiology used to diagnose cancer? Like, of course, you have said that advanced technologies have come up, and depending on the equipments or depending on the technologies which have been advanced, so things have also become easy. I wouldn't say it's much easy, but it has become easy for you as well. So what do you have to say on the modalities part?
Actually, it has become easy and it has become more accurate.
More accurate. Okay.
And so, and as a result, the patient curing rate has been increased. So more and more patient has been cured, and more and patient has been. We have been trying our best to prevent them from further complications of cancer. So if I say the modalities, then it is mainly there are some screening modalities which we call the ultrasonography or X-rays. So from where we screen the patients, if the patient has no problem, then we do not go to further investigation. So a patient has come to me, then he has a chest pain, he has a problem of pain abdomen. So what we will do? If a patient come to me with a pain abdomen, we will first go for ultrasound. So we see the ultrasound, if we see that there is no suspicion of anything, the patient is completely normal, then we always used to do wait and watch. You come after 6 months, again we will see if the pain has not subsided, then we will go for the another investigation. But if we see that there is something abnormality in the ultrasound report, then the next modality will come. Suppose in case of pain abdomen, it is called computed tomography, CT scan. People used to call scans. So you used to go for CT scans. In the CT scans, if we see there is some abnormality which needs further evaluation, then we can go to MRI. So it's a protocol-wise thing.
Step by step.
Yeah, cancer treatment is all of protocols. It is an established protocol. You go to any hospital, you go to any government institute, you go to any central institute. So it is all protocols. It's not like that somebody will treat in a different way or somebody will treat a different way.
And things has to go in a step-wise because if suppose X-ray has been prescribed and if things are not detected in X-ray, then you go for MRI.
For CT scan or MRI. It's based on the organs, the modalities will vary. But the primary investigation is always X-ray and ultrasound. From there, we used to see if there is any abnormality. If there is an abnormality, then we will again discuss with the clinicians. As I told you, a meeting will be held, then we consultants are all gathered up and we discuss, okay, we have to go for that investigation. So likewise, we will prescribe the different modalities. But being a radiologist, it's a very fortunate thing for us that we have different kinds of instruments to detect the cases.
Right.
So if it is not detected by ultrasound, I have another instrument where I can detect it. And finally, we do biopsies. And these biopsies are again reported by pathologists, which are our colleagues. And finally, we come to know
to go through the root cause of the problem.
Root cause. Right. What are the cells that has caused? What is the primary source of cancer? So that's why we go to pathologist.
All right. Doctor, we'll have more discussions, but we have to take a break. All right, viewers, we'll slip into a short break, but do come back soon because we have lots more on the other side. Welcome back, viewers. You're still watching Good Life, the Health Show with me, Puja, and we are having a fruitful discussion. So, Doctor, coming back to you again. Earlier to break, we had an idea about the data. We had an idea about the causes of cancer seen in Northeast India. Now, if I would like to ask you about how radiology can help in a follow-up of treated cancer patients, the ones who have already been treated, how do you follow up? What is
Actually, it is one of the most important part of radiology. I think, I suppose, because as you know, in a common word, people used to say, "कि मेरा फिर से cancer हो गया, मुझे आँखों cancer होल, but I again have that same disease."
Is there a high chances of this?
It's very organ to organ. In which part you have, suppose
depends on
the organ. Suppose a lung cancer might have higher incidence than a stomach cancer, like that. So it varies of patient to patient. It varies patient to patient. It varies place to place.
Place to place and on the stage maybe. Which stage the person was detected.
And most importantly, it varies organ to organ. So different organ has a different cancer, different types of cancer. Because I will not go details into it. So different types of cancers have different chances of recurrence. So to early detection of recurrence is very, very important. And that part is mostly dependent on radiology and nuclear medicine diagnosis. That is called PET scan.
So PET scan. Now, for follow-up, will there be symptoms in the patient? Then only the doctor will prescribe for the
No, it is not like that. It's like that there is a protocol, and sometimes, as you say, you're very right. Sometimes if there is a symptoms again come up, then they will ask for the investigations. But what we generally, our surgeons or the clinicians used to do, after a patient has completely been treated and patient has been said that you are cure of cancer, then there is a call monitoring. The word is monitoring.
Monitoring.
Like the patient has been monitored 6 monthly, 3 monthly, yearly, according to the stage of the patient. After that, if it is seen that the 6 monthly monitoring, it's like a simple, like the patient might come for an ultrasound, patient might come for an X-ray, or patient might come for a CT scan.
That is the part of
this,
the
protocol.
Generic treatment
but
and protocol.
Sometimes what happens, if before 6 months, as you have asked me, the patient develops symptoms, then the patient should come to us or should come to the clinician as soon as possible. He should not neglect those symptoms. Doctor has told me to come after 6 months. Now I am having the symptoms. I will go only after 6 months. That should not be done. Because if you are having some symptoms, it means your body is giving you some signals, that some part of your body is not working properly. Then you should not wait for 6 months. You come before the 6 months, then the clinician will examine the patient physically and then he will refer to us. So there the role of radiology has to come to tell the patient, to tell the clinician, to tell the board that this patient has recurrence, means the cancer has again come up, or that it is something different. It is not related to the cancer.
So a lot of like formalities are being done also when a patient is again coming for a recheck-up or a follow-up, and the examination is done, doctor. So when the examination is done, is the procedure same the patient had went through in his first case, or the examination procedure is different?
Okay, it's not like that actually. If the patient come after 6 months like a normal routine checkup, then the procedures are same. The doctor will tell that you go to that, you do this blood examinations and these radiological examinations, and after that you come to me. So this is the normal protocol everybody follows. But if the patient comes with symptoms which are like not part of the normal checkup, then that particular clinician will decide how to proceed with that patient. Because patient to patient, the symptoms will vary. So patient to patient, the protocol will vary. But if it's a routine checkup, then there is no problem. Patient will be during discharge, patient will be told that you have to do this after 6 months. You collect the reports and come to me.
Now a very common question. Now there must be a lot of challenges also you guys must be facing, doctors or your team must be facing now, depending on the attendance when the patient come with their attendance. Now there are a lot of questions in their mind, a lot of confusions in their mind. How will the things go up, or how will the examination take place? So we have seen like when the radiologist is performing the examination, so we see the attendance. So do you also give a counseling to them, like how things are going to take forward?
Actually,
this is also a very important part as well, I guess.
Very good question, actually. It's a part of our job. It's a part of our responsibility. And not me, as a radiologist or as a medical society, this counseling is our most important part. Because cancer is not a disease for me. It's a social burden to a family. So when any family member has been diagnosed as cancer, so the whole family is actually suffering from that mental pain. Because still today in Northeast India or in India, we think that cancer is incurable. But this is wrong. Cancer is curable. If proper treatment is given, cancer can be treated. So when attendants come to us, we always used to counsel them, and I always used to tell them that follow our protocol, keep trust on doctors, keep trust on the medicines, and by the grace of God, I hope that your patient will be completely normal like before.
All right. Now, doctor, if we want to know about like what are the costs of these radiology modalities, like this will be also some questions, important questions which will be surfacing in everybody's mind. So just an idea about it.
Actually, it will vary procedure to procedure, and different procedures has different rates. Now, if you see most of the government schemes, they always include the cancer patients, and they always have the cancer. So, if I say that now, if you go to a government institute, most of the cancer treatments and the investigations are free. And if you even come to the private hospitals like us, we have that all these schemes like Ayushman Bharat and this 𝗚𝗢𝗙𝗓𝗡. So most of the investigations are under those schemes, and though they get beneficiaries will get in a very less price. And also if you see that though the software has increased, though the cost of machines has increased, but the price is still, I think, for me, that it is within the range that most of the patients can afford.
Can take the benefits of these schemes which are available, isn't it? Now, doctor, a lot of awareness campaigns are being seen to put awareness to the public there regarding cancer and how things take forward. Now, on this awareness campaign, as radiologists, what do you think? How can we can aware people about this?
Actually, to prevent cancer and to reduce the morbidity and mortality from cancer, awareness is the most important pillar.
And hospitals are also like conducting a lot of awareness campaigns as well.
We are conducting all this breast cancer awareness, then we are conducting lung cancer awareness. If you see, there's an anti-tobacco day, then in case of breast cancer, there has to be a pinkathon, or like that, all marathons are going on. Because what I want to tell, that cancer has some stages, like stage 1, stage 2, stage 3, stage 4. The earlier you detect, the better the prognosis. So that is the main, I see, it is the main, if you say that what is the main thing you want to say, the earlier you diagnose the case, the better the prognosis, the better
Because the
is the
treatment
survival
can
of the
be started
patient.
at the
So how
earliest.
can you diagnose earlier? So how can you diagnose? Because the patient will not come to you. You have to make people aware that if
Okay.
you are suffering from something, you come to the clinician, you come to the doctor. So that awareness has to be there among all of us.
All right. So, Doctor, we are really short of time.
Yeah.
So, what message you would like to give our viewers who are watching our show regarding the topic which we have discussed today,
So,
or anything in general?
Yeah. My message to the viewers is that we should not be afraid of that going to doctors. That if we go to a doctor, something bad will come up. That I might have cancer. Because the better you go to the doctor, the earlier the disease will be recorded or detected, the higher is the chance of getting cured. And I think, as a radiologist, I want to say that if some doctors or some clinicians are advising you to some investigations, you should not neglect those investigations, because we are those people who are detecting the diseases.
Okay.
So I think you should never neglect if a clinician referred to you a radiologist for some CT scan or MRI, because there is always a reference is always with a cause. And the cause is to prevent the cancer.
And if you talk about the lifestyle which we are leading,
Yeah.
so that is the only thing which we can change
Yeah.
in ourselves, isn't it?
Exactly.
So on that
Exactly.
note, what you would say?
Yeah, I
our
want to
viewers?
say that the better we will be aware of our health and the better we sense our lifestyle, the higher is the chance that we will be far away from cancer.
Okay. Do you also give these kind of tips when patient comes to you, or you are always busy with the examination?
No, it's not like that.
Okay.
Sometimes we have to talk with patients because we have to give them the moral boost.
Absolutely.
Because nobody comes to hospital with a good mind. So everybody which have an idea that a fear is there. When you enter a hospital, a fear is there that something is not good with me. So it's our responsibility to make them in a friendly and comfortable environment.
That's a nice part for you as well, because like friendly nature will also ease their tensions, and whatever questions will be surfacing in their mind, they might freely ask you, isn't it?
Right.
So there are some patients, maybe like there must be some kind of cases which you have gone through. It might have been difficult for you to handle. So anything related to that, doctor, you would want to share with us?
Look, it's a part of our profession actually, that though we try our best, though we give our best effort, sometimes we cannot save the patient. Sometimes some complications will come out. Then the patient will think that maybe my treatment is not the one that I needed. Maybe there is some mistreatment. But through your platform, I want to say that as a doctor, me or all my team or whole the medical fraternity, they tried their best to save the patient, to cure the patient, and to make the life better.
All right.
So that's my message, that we always tried our best and we always gave our best efforts that the patient should come out of that cancer.
All right. Thank you so much, doctor, for giving those wonderful message at this point in time. And well, viewers, with this, we have come to the end of the show, and we hope that we were able to answer all your queries in the best possible way. And in our next episode, we will be discussing on some other important health issues. Till then, stay healthy, stay fit, and keep watching Northeast Live. Goodbye.